Hello. I'd like to speak to you for just a moment here about the coronavirus. By now you've heard it's spreading in Kentucky and that Oldham County and almost the entire balance of the state has been put into the red zone category. That's the highest level of continuing exposure. More and more people are being hospitalized and contracting the coronavirus. The governor has implemented these new restrictions. You may or may not agree with the restrictions. We all have our opinions about them, but it's important that all of us take the steps necessary to try to protect our family, our community, and ourselves from further exposure to the virus. I have a video here. It's a 17-minute video from Dr. Stephen Stack. He's our state medical director. I encourage you to watch the video and get all the information about where we are in Kentucky on the coronavirus. I think it'll give you a good understanding and perhaps influence your attitude and behavior in the future. So please watch this video.
It's no small accomplishment, unfortunately, that we are where we are and that the public health workforce has had to make difficult choices. So I and the directors from across the state have made the strategic adjustments to focus on identifying new positive cases, communicating with them, and then enlisting the support of the entire statewide community to notify your own contacts of their risk of exposure and need to quarantine. I think that should be no small sign of the situation we find ourselves in, considering how we've hired more than 900 people to help with contact tracing in the state, and yet the current level of disease has overwhelmed that capacity. James or Jim, if you could please project my slide deck for tonight. As I begin this journey with you tonight, I want to thank the governor again. He's been very supportive in allowing me these opportunities to go through in as factual a manner as I'm able, where I see us heading, and the steps that I recommend that the state undertake. None of this is easy, folks. And for those of you who are willing to listen to this description of the evidence as we have it, I hope you find it persuasive. And for those who are skeptical, I hope you find this persuasive too. We're all in this together, and it's essential that we all pull together as a community and that we care for each other and are kind for each other or towards each other, because otherwise the consequences are very unpleasant. So if you look at this slide, you've seen me use these before. This shows 4 states, New York at the bottom. If you look at the right-hand side, New York at the bottom, Arizona above that in green, Kentucky in blue, and North Dakota in red. I'm going to take you on a little journey. This is the number of new diagnosed COVID-19 cases adjusted by population. Now, things have changed a lot over this journey. We've had more testing. We have better treatments. We know more about the disease. The things I'd like to draw your attention to are that New York got hit very hard early on, and then it has maintained good control until recently. When I get to the next slide, these points will become more clear. We went along for numerous months, and then Arizona, go back to the previous slide. Thank you. Arizona in the green got hit with a group of states in the summer, and it had a peak similarly high to New York in terms of new cases per population. As you go along, you'll see now North Dakota is getting hit more than 3 times harder than the first 2 states. Now, I'm aware, for those of you who are attending to the details, we've tested more, and so some of these numbers will escalate. But the disease is also spreading far more rampantly, and I'll make that point with some subsequent slides. What I'd like to draw your attention to is for Kentucky, while we would like our line to be completely flat and not escalate at all, from a public health standpoint, what we've managed to do is to push off any major surge further into the future when we've had more time for scientists to develop treatments, for physicians and other clinicians to learn how to properly care for patients, and now hopefully in the near term to have preventive measures like vaccines. So we are trying to push the worst consequences medically further into the future so we have time to better prepare and blunt those adverse harms. Next slide now, please. So this slide shows deaths. This is total deaths adjusted by population. this statistic, while grim, is one of the most useful because it is one that is pretty absolute. A death is a death. And we work very hard to make sure that they follow the definitions, and we apply those pretty consistently across the states of the United States of America. So if you look, New York got hit really hard at the very beginning. And so you see that they've had enormous death and enormous loss. And this is for a number of reasons. One, we didn't know how to treat COVID patients as effectively as we do now. Two, we didn't have medications that we knew could help them and know when to use them to maximally help people. Three, it overwhelmed the health system so severely that there are probably people that could have been saved but weren't because there just simply wasn't enough capacity to help them all. And then four, there are other conditions that didn't get cared for as people had deferred medical care since the healthcare system had to pay attention fully to COVID. So if you go along now, the next state that got hit hard was Arizona. And they had a similar peak for disease as New York for the number of new cases. But if you look, their mortality rate was much lower. So we had improved how we treat patients at that point. We had learned and we had begun to get some treatments in the middle of the summer to try to help. So Arizona had much less death adjusted per capita than did New York. And that's what you would hope would happen in a pandemic as we learn and we improve our treatment and our response. Now I'm going to draw your attention to North Dakota, which is getting hit horribly hard right now. North Dakota is the worst place on the planet Earth right now to be for COVID-19, at least as far as the laboratory and statistical data would show. It is getting absolutely hammered by COVID-19. And you can see that despite 9 months of learning and improvement and all the optimization we've been able to do, if you have enough disease, the number of deaths will escalate and surge dramatically. And that's what you see happening here. North Dakota is overcoming Arizona in terms of deaths per population. So this is a very rigid statistic. It's not something that's you manipulate or fudge. It is deaths are deaths. And so North Dakota and South Dakota and others up in that region of the country are showing us alarmingly that this disease still is very fatal and overwhelms hospitals when it takes off too fast. Now I want you again to see Kentucky. Kentucky, in most public health measures, doesn't perform very well, unfortunately. We have higher rates of tobacco use, substance use disorder, obesity, overweight, diabetes, uncontrolled hypertension, cancers. We have a lot of things that we need to continue to work on in Kentucky. Despite our overall poor health profile, we have done a very good job in Kentucky minimizing death related to COVID-19. And so there may be some out there who feel that they haven't known someone who's died from this. And I'm happy for you. I'm happy that you've not had to go through that experience of loss that so many have had to go through. But that's not accidental. This is because we've taken a lot of very decided measures in Kentucky to try to keep people safe. This is not accidental. This is active and careful attention to trying to use the best tools we have available and to adjust them over time. James, the next slide, please, or Jim. This is CDC statistic or data from 2017 and 2018. It's the top 10 causes of death in the United States of America. It shows the typical ones that you're familiar with, like heart disease and cancer at number 1 and number 2. I want to draw your attention that this new disease that did not exist until this last year, COVID-19, is now number 3 of all-cause deaths in the United States of America. Over 245,000 Americans have lost their lives to this year alone, and it is now the 3rd leading cause of death. And it is the 3rd leading cause of death by 50% more than the 4th leading cause of death, which is unintentional injuries. So folks, for a disease that did not exist until this year, this disease is on track to be the 3rd leading cause of death in the United States. And were this to go on longer, it could come much closer to cancer. So this is a real dangerous condition, and it's cost a lot of people their lives. Next slide, Jane. So on this next slide, this is an animation. This takes us over the last couple months of journey, and the colors are self-evident. So you can see here when we get to the current day, just how much worse our map has become. So red cases, red counties, this isn't just numbers, folks. These are people with COVID-19. And a certain proportion of these people with COVID-19 have prolonged recoveries, have hospitalizations, have ICU admissions, have ventilator use needs, and a small percentage of them die. But a small percentage of a big number is a really big number, and that's what we see here. So this map is very concerning. Jim, if you could do the next slide, please. I keep going between James and Jim because there's two of them there, and I'm not sure who's clicking. I'm sorry. So this is COVID hospitalizations in Kentucky. So again, this is a statistic that is very concrete. It's the number of people the hospitals are reporting are admitted to their facilities for COVID-19. And if you look at this, this goes 2 months from September to November, the 16th to the 16th. And what you'll see here is we have roughly tripled the number of people who are admitted to the hospital for COVID-19 in the state of Kentucky in 2 months. We've quadrupled in about 4 months. We've tripled in 2 months. And what happens is the curve gets steeper and steeper over time. At this point in time, and this is a rough estimate, probably 15% or more of all patients in the hospital in the state of Kentucky are in the hospital for COVID-19. And the rate of hospitalization for COVID-19 continues to escalate rapidly. So that means the more people with COVID-19 in the hospital, the fewer beds available for other people who have other needs. And if the hospitals ultimately get filled up or exceed the staffing ability because we don't have enough healthy doctors and nurses and other folks like respiratory therapists and pharmacists to care for folks, then you start having other people with other non-COVID diseases suffer consequences because there's just not enough healers to heal them. Next slide, please, Jim. This is the stair-stepper graph, and I'm going to show you 3 of these in a row. And I'm going to make very focused point here. We've had 3 escalations in this disease, in this pandemic in Kentucky. The first escalation was the one when we had the most unknowns. This was in March, and you can see we started to have the beginning of an exponential growth. I'm going to share some simple math here. Doubling numbers are doubling numbers. So 1, 2, 4, 8, 16, those are numbers that are doubling, but they're small. All of us can relate to the number 1 and the number 16. Neither of them seem particularly large. I'm going to give you the same series with a few more zeros. 1,000, 2,000, 4,000, 8,000, 16,000. Those are still just mathematically doubling numbers. The consequences are staggeringly different. In the beginning, on the left, when we intervened rapidly, when we stayed healthy at home, when we took aggressive and brisk action at the start, we stopped the growth. And so that red line that's flat shows, I think, about 13 or 14 weeks of essentially a plateau. Because we did healthy at home, because we took prompt public health action, because Governor Beshear made difficult decisions to help keep us safe, we blunted that growth curve and we stopped it. We stopped it dead in its tracks, and we kept ourselves at a relatively stable level of disease. Now remember, during that time, scientists were at work to find new treatments, new cures, new ways to help people who have this disease. So we were buying ourselves time. Next slide, please. So here you see our second escalation. If you could put these side by side, you'd see the slope of that curve, or how quickly it's rising, is a little bit brisker. When you have more disease, the numbers double. When they double, they get bigger much faster. And so what did we do? We took other steps, one of the biggest of which was to put in a statewide mask mandate. Now, you'll notice when we put in these measures, there's about a 2 to 4 week delay. And I'd say it's more like a 3 or so week delay from the time we do the intervention until the time we start to see the impact. So about 3 weeks or so after the statewide mask mandate, we entered a new plateau. And now we've got what you see there in hindsight was a roughly 11-week plateau. That is an enormous accomplishment. That means we managed to stop the disease in its tracks again and buy ourselves more time for the health system to adjust, for us to build up resources, and for us to make other preparations. If you could go to the next slide, please, Jim. This is where we find ourselves now. This is terrifying. This is now growth from a much higher starting place. The numbers show no signs of relenting. This week is on track to set a new record already with just 2 days worth of data. There has to be a third intervention. To stand by and not take some sort of action to try to interrupt this progression would be to leave ourselves open to substantial harm that we have reason to believe we can help to prevent. But we can only prevent it with your active cooperation, participation. We really can only actively prevent it with your care and kindness towards each other. If the numbers aren't persuasive, please remember these are people, these are family, these are friends, these are neighbors. And I haven't even mentioned the fact that 10 to 20% of people who get infected at minimum have a multi-week recovery where they are ill or sick or for longer than just the typical viral duration of a couple weeks. And some have recoveries that take months or longer. Next slide, I think, is my last one, please, Jim. So these are the White House slides that the governor used. I just wanted to reemphasize these points. Thank you very much. I've made this point, folks. I'm trying to be the scientist here and just lay out the evidence that we're using to reach the conclusions. If people choose not to believe these things, I don't know what else to say. I have to appeal to the leaders in your local communities. If you want businesses open, you want schools open, you want people safe, we want the economy working, and we don't want to pay a price in terms of disability and lives lost, we've got to pull together. It's not political. This mask that I have, and I wish I could remember who gave this to me, says all I'm spreading is love. That's all we're trying to do, folks. We're trying to keep people safe from a once-in-a-century pandemic. Like the governor said, if your house is burning down, well, this is not what he said, it's what I'll say. Are you going to roast marshmallows over your burning down house, or are you going to run for buckets of water and try to put it out? If your neighbor's house is burning down, are you going to stand idly by, or are you going to try to rescue them from the fire and try to help? Folks, fundamentally, this is about our care and concern for each other. I sincerely hope, and I am confident, that if we come together, we can interrupt this third climb, and we can do so before we have a cataclysmic result. But folks, it's got to be Team Kentucky pulling together. And Governor, I realize I take a lot of time with these presentations, and I thank you for that. I really appreciate your commitment to giving the Kentuckians all the information we can so you can make an informed decision and have confidence that what we're doing is our best effort to try to keep people safe. Back to you, Governor, and thank you.